Hi, my name's Ashley Miller. I'm here at the Health 2.0 conference, and I have the pleasure of introducing and interviewing the honoree. Can you please introduce yourself and tell us a bit about your organization?
Yes, thank you. My name is James Conyers. I'm the CEO of Enlitic. Enlitic is a healthcare tech company that uses a significant amount of AI to focus on critical, important aspects of the clinical workflow. Instead of focusing on point solutions or single pathology based solutions, we're looking at solving the problem in healthcare as much earlier in the clinical workflow by using intelligence differently so that hopefully we can, on a global scale, reimagine healthcare and how healthcare is delivered.
Wow. And with that being said, what inspired you to take this new approach within the health fields?
I've been in the field for quite a long time, 25 years to be exact. And over those 25 years and traveling around the world, I've seen so many different clinical workflows and environments and cultures when it comes to healthcare. And one of the things that I found was that they all experience the exact same challenges and the exact same issues. But every technology that the companies that I was working at and all the other companies that I was familiar with weren't actually solving the real problem. And so I spent 20 some years trying to figure out how do we get to a place where we're actually solving what is really going to make a difference and to really help us to revolutionize healthcare and to change patient care as we know it. And so it wasn't until I had the opportunity to come to Enlitic, who was really adamant and passionate about going after and attacking the real hard things that nobody has wanted to do for the past 40 years. And that's kind of what led me to where we're at today and how we are focusing on what I call the non-sexy AI, right? It's the behind the scenes AI that drives automation, efficiency, capacity, and that is focused on helping the clinicians and the clinical staff because they're the ones that have to deliver patient care, right? It's not the vendors that impact the patient care or the treatment plans. We need to build tools to help them to be able to do that. And that's what led us here or to where we are today and why we're focused on this non-sexy AI that runs way upstream and in the background to drive dozens of downstream efficiency and capacity value for our health systems.
Thank you for your contribution. And like you said, for others that are looking to revolutionize, like yourself, what is some advice that you would give them?
Yeah, that's really a great question. The advice that I would give anybody, especially in startups and even in mature companies, is to stop for a second and really pay attention to what is considered to be the continuum of care for a patient, regardless of the clinical specialty that you're in, whether it's ophthalmology, wound care, dermatology, radiology, any of the 45, and really focus on the clinical workflow. The answer to the solution is always in the clinical workflow. If we really understand what the clinicians are dealing with and how that impacts the patient, then we can really start to change healthcare. And then our products that we create and the innovations that we adopt are going to have a much more significant impact. So first, stop and really look at what you're trying to solve, but look at it at its core, not at a piece of it, right? I just want to solve this one tiny piece. How do I solve it at the beginning so that all of those tiny pieces are fixed downstream? And then the second thing and the most important is data fluency in healthcare. We have got to focus on how we finally solve once and for all the 40-year-old interoperability issue that has been plaguing global healthcare and causing 99% of all the challenges that we have. Because if we own the data, if we understand the data, we can share that data and we can use that data intelligently to make better decisions, better devices, better drugs, and hopefully have a lot less people standing in emergency rooms crying because medicine failed us.
I understand that completely. And within being attendance, congratulations once again. In being here at the Health 2.0 conference, what has your experience been like?
It's actually been a really great experience. The format and the forum is a little bit different than you see at most of the other conferences, and it is this much more intimate setting where you can have these very hard difficult conversations to really push the envelope on having people think, and then the interaction with the panel and the people in the crowd so that they can ask questions, so that we don't just stand up in front of somebody, give a speech, make a statement, and then what next, right? There's no outcome, there's no interaction with the customer. I feel like this conference has created connections with other people in the industry, customers, as well as other vendors and tech startups, that we'll be able to close the loop when we leave here. Right? I've made a lot of people that said, "Hey, can we figure out how to close that loop when we're done?" You don't see a lot of that at the other conferences. It's always, "Oh, that was a great speech, but what's next? What do we do now? We're just going to talk about the same thing next year." I think this conference has the potential to change that.
And with that being said, and speaking on what's next, how can the audience members connect with you online that are looking to not only support, but that want to also collaborate and connect with the things that you align with?
Yeah, well, one of the easiest ways is just go to www.enlitic.com. That's ENLITIC.com. We're all over LinkedIn. We spend a lot of time on LinkedIn with posts and articles, and so you can definitely contact us via LinkedIn. We're also on Twitter. We're also on Facebook. So we're pretty much everywhere there is on a social media format, and you can hit us up anytime and connect with us via those forums.
All right. Well, you guys heard it here first. Once again, thank you and congratulations. And it's been a pleasure speaking with you.
Thank you. Perfect.